would like to now start the session of our today's program, and I'll like to have as an opening batsman Dr. R Sudhir. R Sudhir is a graduate of the Madras Medical College and is associated with Sankara Nethralaya. He is the head of the preventive ophthalmology and is a cornea and refractory surgery specialist. But more importantly, you see, once anybody gets attached to Sankara Nethralaya, he doesn't need any introduction because he is part of such an iconic institution that really we all submerge our identity once sometimes the identity of your organization is that great. And he is going to talk about why that organization is so great, what happened, and where in their hospital digitization, what role as it plays, what was the life before and after this digitization. So over to you, Dr. Sudhir.
Thank you for the introduction and thank you for inviting me to be part of this CAHOTECH wonderful IT conference for digitizing. I'll share our journey, how digital adoption changed life before and after at Sankara Nethralaya. So to start off, why do we need EMR? The EMR, we had almost more than 5 million files. We had 2,500 patients visiting the hospital, 150 surgeries per day, huge storage space and manpower to handle these records. And you can see the photo here, 2005, how these files are ranked. And we have huge data which is untapped. We need the data for measuring the quality of care, medical and surgical outcome, finding patients for research, generating case series, and the most important thing is for auditing and quality control. And the data is generated at high volume, variety, and velocity, and that needs to be captured and cleaned and used. So that's the need. Apart from that, we had multiple branches coming up. So patient hops between the hospitals, and for continuity of care, we need to have the record. And that is where we found the EMR has come to our solution. So EMR is not just a part of, it is a part of paperless hospital along with HMS and diagnostic modalities and multiple other APIs which gets connected for completing this digital transformation. So I will take you through our journey and show you how at each level, how it has changed. So we developed our hospital management system, electronic medical records, in collaboration with TCS, and we branded it, and we are now having implemented in other hospitals all over India and abroad. So this had all the modules of handling HMS, EMR, APIs for artificial intelligence, and also established standards of HL7 and all the standards that are required for EMR. And so the important thing is, even though it is initial, there's huge amount of cost involved with this, but the return on investment is huge in healthcare when if somebody invests in electronic medical records. So the first thing which we saw is huge amount of space was getting taken by the electronic medical records. So you can see the space, how it has been increasing need. So when we put a value to this value for the space, and we could immediately convert that, we could save almost 69 lakhs per year by going ahead with EMR, because all these space could be used for multiple other purposes for expanding. Then comes the time saving, time benefits. As we all know, once the data is available, we can access the record, locate the record, dictating referral letters, case summaries, writing prescriptions, and that is very, very important in reducing patient waiting time. In all the quality control, the first feedback coming from all the patient is waiting time is more in all the hospitals. We also did a study to show that paper records doesn't take much time compared with electronic records. And this was a time motion study, and it proved there was no difference between electronic medical records and paper records. The most important thing is patient wants transparency, and you can do that with EMR, where we can show them the track where they are in the queue and what time it would take. So we started showing this to the patients. Then many of them were very happy, and they don't come and disturb the secretary, and they would go for a coffee or come back, and they are very happy. So we also tried working with AI to build up, can we predict the time when the patient would be called based on the current reporting time, how the doctor has been handling the patients today. And this was one of the way in which we could identify the predicted time, and we could tell the patient in advance. Most of the time, this is a pilot study which are currently ongoing, and we wanted to flash this as an SMS to the patient so that they can be more prepared to do it. Then comes the more important thing, the electronic medical records. I am just showing a sample of it to show you a dashboards of a patient record, the clinic, the entire continuity of care, patient undergoing surgeries with multiple icons to show and pick them up, and you can search through the record and with drawings. We established a lot of templates so that the data entry can be done fast. So that saved much of the time for the doctor to reduce their entry into the records. So we also came out with a smart text where they can just type one letter or two letters, the entire paragraph or sentence can come. And if they use abbreviations, that get automatically converted into full forms. So
Patient is advised right eye cataract surgery.
We also had
SN
Dictate
lens implantation.
Where a Google
Pros
AI
and
was
cons of the
implanted.
procedure was clearly explained to the patient.
So this also helped them to reduce the entry time. Most important in ophthalmology is the drawings, and that was the most success for all of us. So we have plenty of drawings which could be easily entered during the patient visits, and this can be copied from the previous drawings, and then you can automatically make a changes. So this reduces the waiting time. And now with the latest technologies, we could also annotate the images. So even the drawings can be reduced. So we can have the pictures of the patients taken, and then you can annotate and document them much more clearly. And we also had a very powerful search engine to get the masters to search the templates, and using various combinations, we could do that. And all these medications can be done very fast. So we proved, and we had just repeated a study of the paper with EMR, and it has reduced the time much less. And this is because of better search, better templates, customized templates, prescriptions, medical prescriptions are pushed to the stores or to the optical stores, and the data entry at all levels are reduced. The most important the patient wants is a medical prescription and a medical case summary at the end of the visit. And that is where many of the doctors has to dictate previously, and the more time is taken. And once we had EMR, this was like with just one click of a button, we had the entire summary generated, and which we can either print it to the patient, and we can give it to the or email it to the patient. And if a patient gets an email, all the attachments of the diagnostic modalities also go, and they can download them. So which now we are having a patient portal where they can do it. Similarly, integration with stores, because when you go for surgeries, we need to have multiple IOLs ordered on the day before, because you should not have a surprise, because we have variety of lenses available, and if we can't store all of them, certain lenses are too costly, so we need to be order them. So the pre-ordering process was all, and they can have an alerts which can really tell whether the patients the lenses are available in the stores. If not, how to get them. And the most important thing is the time between, like for integrating with all the equipments and having the investigation reports immediately as soon as they are available. Sometimes the patient has to go to a different clinic to get the investigation done because the equipment may not be available. And once the patient goes there, if the tests are done, it can be also done a teleconsultation from that center, and you can reduce their waiting time. The more important thing, OT, the discharge time is reduced completely. The patient walk through in the OT. We have the EMRs at every place, from the billing to check-in in the ICUs, pre-op areas, and intraoperatively. As soon as the surgery is done, the surgeon completes the OT notes and the discharge summary, and that is wheeled along with the patient. So that's fast we can do. The advantages: patient record is available immediately. We are now able to do teleconsultations. We have a lot of alerts which are incorporated, and the most important is the research, and that is where data mining comes. So in the teleconsultations were done initially only for pre-patients. Now it has been a dictum, because during COVID, we had almost 10,000 patients whose appointments has to be canceled because of the lockdown. And we could build a teleconsultation platform over the EMR, and we could do almost 8,000 teleconsultations over a period of 1 month. And all these, the doctors were able to work from home. So we developed a patient portal where the patient can automatically do their history, and they can do a self-assessment. They can do a vision assessment using available apps, and they can also take a pictures using their mobile, and they can upload these pictures. In case they have a old reports, they can be uploaded. and they were connected on the cloud telephony and Google Meet for audio calls and the video calls. And in case the patient is not able to do this, we also had an optometrist who intervene and guide the patient in model 2, where the patient is guided to take the history, ask them to do vision check, do the questionnaire, and upload the reports. So now the integration has happened so much that in the OPD, I would have teleconsultations links coming in between, so that during the time I can also have a link from where the patient is calling. We had another model where we also introduced partnered with optical chains, where the patient can go for their follow-up visits and then connect with the doctor. We trained those optometrists, we equipped them with the fundus cameras, applanation tonometry, and then the patient can go there, get the entire workup done by the optometrist in the optical store, and then connect it with it. Finally, the most important thing is for quality is the patient feedback. Before era of EMR and digitization, individually we have to take it. It's just a 5% of 10% of patients are had a feedback. Now we have almost all 100 patients feedback forms are sent. The feedback responses are increasing day by day. We are working out to see how to encourage all patients to submit their feedbacks, and we can have a dashboard to look into all the feedbacks, go through them and address them. Then the most important comes for the research of recruiting patients for various studies based on the criteria of we could build up into the EMR, and if any patient fulfills this criteria, we can send an automatic SMS to the PI and get involved. The most important thing is the data mining tools, which we enabled it, where we can extract data from any kind of search and then give it to them. Other important thing we found is unstructured data and structured data. Using SNOMED, we would use all the case summaries of unstructured data converted into a structured format. We also extrapolated this for drawings, where we can do a OCR based, and all the annotations can be converted into SNOMED codes, and we can still use them. This is how the output results of various surgeries are built. This graph would take almost 1 month to 2 months to get all the data, enter them, and get all these things. Now we could do all these, which was there in Excel templates. We could now do a real-time analytics using SQL queries and data cleaning and conversion, and then building it up onto the Power BI and ML and back to EMR using an API. So this is a dashboard which we developed for outcome analysis of refractive surgery, and you can see them. They are interactive dashboards and they are live automatically because of the structured standard data. All these outcome analysis could be done. So even these graphs which I showed you, they're all live. As the data patient comes for a checkup, these graphs gets automatically built, and we can have data of even like 20,000 visits. They are built over a period of time, and using interactive graphs, we can actually run through the and build. Similarly, we are working on multiple outcome analysis. This is for the cataract surgery outcomes, because the quality is important. If somebody is not performing well, we can go look back into these doctors and do that. And that was not available before. Is it EMR restricted only to hospitals? No, EMR can be done for camps. So we have also implemented EMR at camps where the previously they used to do them, they come back to the hospital and then do the data entry. Now with the very good connectivity and EMR available at the camps, all that can be done from the camp site also. So the most important success for implementation was a good training. This was a picture of 2005 when the training has been happening with the old computers and all that. But the success was because of an excellent training. And even though there are challenges in IT adaptation with financial challenges, challenges in development, training challenges, implementation challenges, and real-time like safety, security, privacy, and performance, we have to go through them. And once we have all of them taken care, the change is really beautiful, and the fruits are very good. So we could replicate this model at multiple institutions now. We have almost 20 eye hospitals with 120 locations outside Shankara Nethralaya who are using our EMR. So we have about 15,000 users. Currently, every day, about 25,000 appointments are handled. They are not only in the main cities, they were even in the 2-tier cities. And this has using the guidelines and standards They are improving the quality of care at even these hospitals. I thank you for your patient hearing, and I'll be happy to take questions. And this is my team, which we had been working tirelessly for getting all these things done. Thank you.
Thank you. Thank you, Dr. Sudhir, for a brilliant presentation. And I am sure that you have made a tremendous case for people to get motivated for digitalization.